and to protect each other. We are going to continue to do that. Now, obviously, we have to ensure that this investigation is done and that it is completed. But if this is in fact what it looks like, I want you to know that we're going to do everything in our power to find whomever burned this church down. To the people who attend this church, what you and I know as Christians is that our ability to worship is not confined to any one building or any one space. We will still be able to gather in time and worship an almighty God. I am committed to that, and I know the people of Holly Springs are committed to that, and I know that the people of Mississippi are committed to that. Thank you for giving me the opportunity to say that today, and God bless our entire state. I also want to talk today about our next phase in our efforts to rebuild as we come out of this pandemic. We have to focus on raising the wages of our workers, not simply getting them back to work. The best way to do that is through workforce training, investing in Mississippians to help them earn more on the job. I will be working to propose a substantial investment in workforce training, facility capacity expansions, where our training institutions can quickly upgrade facilities, add equipment to train more Mississippians with skills that lead to higher paying careers. Additionally, a number of employers prefer to train people on the job. For those out of work and seeking opportunities, I want to encourage as much on-the-job training opportunities as possible. For those employers willing to start employees at an attractive wage, frankly, a wage that competes with these new federal unemployment benefits, I am proposing to partner with these companies to cover a portion of the wages during the on-the-job training period through the end of 2020. The best way to get Mississippians into higher paying jobs is to get more Mississippians qualified for the high-tech, higher paying jobs many businesses demand in today's economy. These jobs are found in the manufacturing space, in energy, in healthcare, in information technology, in communications, in logistics, and in construction. We want to direct Mississippians of all ages towards the career pathways that are demanded by the economy and provide the best paying opportunities for our citizens. I will ask the legislature to use CARES Act funds to help these Mississippians to re-enter the workforce. The reality is, we should not be looking at plans simply to spend the CARES Act funds. We must develop plans to invest the CARES Act funds. I am committed to it, and I look forward to working with our legislative leadership to make this a reality. To accomplish this, we must have a proven leader in the right position to maximize our workforce development potential. I believe that the position of chair of the State Workforce Investment Board is critical, and I believe that that person is Patrick Sullivan. Patrick is the president of the Mississippi Energy Institute, which helps to grow more energy jobs here in Mississippi. They also established the Skills Foundation to help boost Mississippi's efforts to help our young people enter job training programs and get good-paying jobs in high-skilled trades. Prior to that, Patrick was the executive director of the Recovery and Renewal, as well as policy director for Governor Barbour, coordinating recovery from the Deepwater Horizon spill, from flooding, from tornadoes, and even more. There is no one more qualified for this position, especially in this unique time. I'm honored to have Patrick here with us today, and I would like to invite him to say a few words. Patrick?
Thanks, Governor, for your confidence, and thank you for your leadership throughout this crisis. Looking ahead, an effective workforce development strategy is perhaps the most important economic issue for Mississippi. For those who don't know, the State Workforce Investment Board is created by state and federal law to be a business-led and an employer-led entity to develop strategy and monitor that strategy for strategic workforce growth in Mississippi. So the mission is, as the governor said, to get more people trained into the right areas. So one, we have more individuals across Mississippi who are qualified to enter higher paying careers, earn higher incomes, and two, to better meet the business demands, the demands of our employers, and provide the types of skills into the workforce that today's modern economy demands. We believe that what gets measured gets done, and our plan is to set targets, measure progress, and work with the many partners across the state to achieve this mission. Those partners include the Mississippi Legislature, who appropriates and directs spending to all of our training and educational institutions and other public agencies that are involved. It includes the schools and colleges across the state, who manage the many students that go through our systems. It includes other public institutions, includes the local workforce areas and other local nonprofit partners. And of course, employers and businesses are critical. The point being that for mission success, we all succeed together. As the governor said, the focus going forward should be an intense, persistent focus on how we can find and create ways to get more Mississippians into higher paying occupations. To be clear, this is a years-long endeavor, but one that will pay dividends down the road and move Mississippi up. I appreciate the governor, I appreciate his team, and we look forward to the work that lies ahead.
Thank you, Patrick. There's no question that the bill that was signed yesterday focuses on our small business owners, as well it should. We also must focus on those individuals, those nearly 250,000 Mississippians who have filed for unemployment insurance over the last 10 weeks. And this is one effort where we can provide them job training so when they re-enter the workforce, they can do so earning more money than they did before this pandemic occurred. At this time, I want to turn it over to Dr. Dobbs for an update on our data.
Thank you again, Governor. So for today, we were reporting additional 255 cases and unfortunately 10 additional deaths. That brings our total case count up to 12,222 and 580 deaths. We have estimated 7,681 recovered individuals from COVID-19. If we look at hospital utilization, we do have relative stability, but we still have a lot of people being hospitalized. We have 87 COVID patients on the ventilator in the hospital, which is the highest number we've had. Now, it's not significantly higher than our sort of baseline, but it's a reminder that coronavirus is out there. People are getting sick. We got to stay diligent. We have significant numbers of people in the hospital, 441, but that's relatively stable, as is the ICU total number. In regard to testing, we have tested thus far over 125,000 times for coronavirus. It has been a little bit of a interest in serology testing and how that contributes to the total number of tests that we have performed. The two tests that we have available now, one of them is the nose swab, and it detects the genetic material of the coronavirus. And that's most useful for finding people and trying to see if they have infection right now. And that's the one that we've been using primarily. But there's another test that's a blood test, and it's called a serology test. And what it does, it looks for the antibodies. The antibodies are the little bullets that your body makes to kill a virus, but they only really show up after you've had the infection for a little bit of time, and usually it only shows up after the infection is essentially resolved. And so it's really a marker of prior infection, but it's been something that people are doing more and more. And so of the total number of tests that we have done, 4,055 are those serology tests. So a small minority are of that type. Now, how does that go into the case count? We have an investigation that we go back and look and see, did the person have symptoms of coronavirus, or were they a close contact to a known case? And if they were, then we count them as a case, but that's only accounted for 80 of our total cases thus far. It's something we'll make sure that we keep informing people because they're very interested in the serology. But if you want to get diagnosed for acute disease, if you're sick right now, the blood test is not the right test. It's still going to be the nose swab. Again, regarding testing, I encourage people to get tested if they need it. If you have symptoms of coronavirus or if you think you've been exposed, use your private clinic or go to one of our drive-in clinics. We do have a free drive-in clinic tomorrow in Mendenhall at the Simpson County Livestock Arena. So if you're in that area and want to get tested tomorrow, please go to the UMC COVID website and you can get an appointment. Thank you, Governor.
Thank you, Dr. Dobbs. Again, Simpson County, testing tomorrow. And so if you are in Simpson County or around Simpson County and feel as if you need to get a test, we encourage you to sign up at the UMC website. Thank you very much, Dr. Dobbs. Again, Director Michelle is out and about visiting with local officials, and we have his very, very capable number 2 in charge over at the Mississippi Emergency Management Agency, Mac. The floor is yours.
Yes, sir. Thank you, Governor. I want to report out that currently the state of MEMA, we're still working 15 federally declared disasters. Gentleman to my left, we actually worked a couple of disasters together. Went through some times with Katrina and oil spill and others, and it takes every state agency and every entity to pull this off. Real good meetings this morning with our Codell congregation up in Washington. We continue to brief them on a weekly basis. They're hearing from their constituents, sir, and we're able to respond to those appropriately in any critical infrastructure problems or issues that they may have that doesn't come to light necessarily on the local front. So looking at our current disaster, the last one, 4538, it was, we have about 20 counties that are still up for joint damage assessments between FEMA, MEMA, and they're actually validating those now. So we hope to be able to get Marion County and a few others added to that disaster and be able to move forward. Our individual assistance centers that we have out for the Easter storms, they have done a great job. Over 2,000 applicants. Money continues to flow, approximately 2.4 to 5 million in housing assistance, and that's individual assistance, rental assistance, and other needs that they might have. We continue to have FEMA coming in and doing the backside damage assessments, as well as getting the necessary paperwork done so those individuals can move forward. On the report, we have our Mississippi Veteran Homes Task Force with UMMC, ourselves, and the Sonny Montgomery VA Hospital. They are providing staff to assist those state veteran homes as well for in the state to go and give them extra training and to look in on those long-term care facilities as we're moving forward. FEMA has put out a notice that we're shifting logistics of the whole COVID-19 response nationally, our territories and everything over to the Defense Logistics Agency. Well, what does that mean? That means about 26,000 employees. All they do all day long is procurement and deliver items worldwide to any military personnel or those support personnel at a moment's notice when they need it. So it's a huge arm that's coming into the fight with us that's going to be able to go the long haul. As FEMA and other federal agencies, we're shifting toward the Southeastern Conference of Disasters. We're in prime hurricane season, so we need to focus on that. And here at the Office of MEMA, all 82 counties in the Band of Choctaw Indians, we've been doing this for about 3 weeks. We know where we are. We know what storms do, and we're preparing for the shelter operations as well. Just had some new guidance that came out today from FEMA. We understand that our normal shelters are going to be at maybe 2/3 population or half of what we would normally be able to put in. 77,000 capability right now in our normal shelters, so we're going to have to adjust, and we know that. So we're working with the American Red Cross, with the Department of Human Services, as well as FEMA to come up with a game plan. And we'll have a conference call next week, sir, to be able to tell FEMA where we think the shortfalls are, where we're going to shore up, and what we're going to do. And where there's a shortfall, we plug it with MEMA, and we make it happen. I do want to report in that been working with the Secretary of State's office. We have elections coming up June 23rd. So we've got about 12,000 poll workers in the state, and we've told the Secretary of State, Watson, that we're going to provide about 12,000 masks for those workers, and we're going to ensure that they have the right PPE and the right techniques, working with the Department of Health. How do we need to do that, bringing a lot of people in? And we're also preparing for the November elections, which will most certainly have the bigger turnout. So what's happening today at MEMA? Well, my mother told me the other day, you didn't report out on the counties. I wanted to know what the counties got. Okay, Mom, 82 counties in the Band of Choctaw Indians, we pushed 1.7 million masks out today. And that's community masks. And that's significant, what we've been able to do and gather. You're gonna look at, I've also got 3.1 million on the way community masks. What's population state of Mississippi, 2.9 or above. These masks are gonna be worn a couple or three times, then you need to either wash them or replace them. So, sir, we're getting ready. We're also holding in reserves some mask and PPE for any outbreaks, as we experienced with the 7 counties earlier, and that worked. We were able to get that PPE out there on your direction and Dr. Dobbs, and we were able to stop that and move forward. And we also have masks in reserve. We are preparing for the shelter mission. 77,000, you can bet I have probably 140,000 masks purchased separately for that shelter mission that we're getting ready to do. So the state of MEMA is good. Have an excellent staff over there, sir. It's not just myself and the director. We have staff that they're working 7 days a week and they're making it happen. And that's all I have, sir.
Thank you, Mackie. I'm proud of your efforts as well. You have done great work. Your agency has done great work working hand in glove with the Department of Health and their team. We are continuing to do the things that are necessary to ensure that our people are as best prepared as is possible for this pandemic, the likes of which we haven't seen in this nation in well over 100 years. With that, I want to thank everyone for being here today, and I will open the floor to some questions. Courtney Ann?
When you talk about the increase in workforce training and what you hope will be an investment there, what is the message that you and or Patrick have to folks who maybe are out of work right now, and the flexibility that they may need to have about looking to a new career? Perhaps they're anxious about the idea, even if it would be the promise of more money, to look to a new job where they would train for something they haven't done before.
Well, what I would say, and the question is with respect to those individuals who are out of work in our state, those who, many of whom have lost their job through absolutely no fault of their own, and in fact, in many instances, because of government action, that they actually lost their jobs. Now, we did see a large number of individuals going back to work this week. Total numbers have come down, and that's positive news, but we're still hundreds of thousands of Mississippians out of work. And what I would say to those individuals is that my heart breaks for you. I know how challenging this is. We are doing everything in our power to find immediate assistance for you through the unemployment insurance. But I also would say we can't necessarily change what's happened in the past, but we can look to the future. And if we're looking to the future and we're investing in our people across Mississippi, then we can make a difference. We want to take those individuals that are maybe making $10 or $12 an hour now in a particular job, and we want to get them help and training so that they can make $16 or $18 or $20 an hour in the future. And that is my goal. That is something that I believe, with or without this pandemic, that's our ultimate long-term goal in Mississippi, is being able to train and retrain our workforce. We talked about it in every corner of the state in 2019. It was a message that resonated with people of all political walks of life. People know that we want to invest in the state and invest in our workforce, because those are the real Mississippians every day that need it. Patrick?
Thanks. Let me provide a little context here. So prior to the coronavirus, the state of the economy was there was a number of employers out there who were looking for high-skilled workers, and there just wasn't enough of them. The supply of what we were producing in Mississippi in a lot of cases just didn't meet the demand. Now, of course, what we've seen over the last several months is, some 250,000 people on the unemployment rolls in Mississippi. So the question is, Obviously, there are economic headwinds in front of us. The question is how fast or how long is the recovery going to be? We live in the age of information, so to answer your question, what we hope to do is to at least do the best job we can at getting this information out. So your questions, what are the best opportunities out there in the workforce? Realistically, what type of training can I access that would get me qualified for a higher paying occupation? How can we connect people? The governor mentioned his wish to provide wage supplements for employers who are willing to pay an attractive wage and do on-the-job training for people. There are some businesses out there who have not slowed down through this. Amazon is one that comes to mind. They have a distribution facility in Northwest Mississippi. Employers like that who may be ready to start hiring people now, how can we help people connect the dots? And all of that is done, it's just through better information. And so one of our tasks ahead here in the near term is to consolidate this information into one place and hopefully start to push it out in a highly visible way where it's easily accessible to people.
We hope that every single business that had to close their doors during the pandemic reopens, and we hope that they rehire every single person that they had working. We know that that is not likely to occur. We know that there are going to be many that do, and unfortunately many that do not. And so our task is to take those individuals that have been unemployed, become unemployed, and get them connected with those employers who are hiring and make sure they have the skill set to produce.
Hugh Keaton with WLOX has a question. Hugh?
Actually, Dave Elliott here. Thank you, Renee. I appreciate that. Governor, California and other states have already announced the delay of fall semesters at state universities. Other states are planning to move forward. Today, the IHL passed a resolution directing all 8 public universities to make plans to resume this fall, and that includes offering as many in-person classes as possible. That was the Safe Start Task Force that came up with that. How much did you encourage that, and do you have any concerns regarding that?
Well, thank you for the question. The question is regarding the vote by the Board of the Institutions of Higher Learning to move forward with the anticipation of having campuses back open in the fall. I believe that the board made the right decision. I believe that they are certainly going to have to start the planning process to do that. I don't believe that the campuses are going to look exactly in September of 2020 like they looked in the September of 2019 timeframe, and because of that, every university has to make the necessary adjustments to make that happen. However, we do believe that it is likely that the virus is going to come back in the fall to some level, and we're going to have to be prepared for that. We have already started working with the Department of Health, the Mississippi Emergency Management Agency, and others because we have gone through the last 10 weeks or so. I think we'll be better prepared to deal with it. We'll be able to make better decisions in the fall than we did in the spring, because we know what worked really well and what didn't work as well as we would have liked. And therefore, I think we're going to have to plan for a fall of 2020 in which it is likely that the virus is going to be amongst us, and we're going to have to be smart. We're going to have to socially distance. We're going to have to slow the spread of the virus again. And but I also believe that we cannot shut down businesses, nor can we shut down universities or schools for years and years on end. I've said repeatedly, we can't even shut them down for weeks and weeks on end. We certainly can't do it for years and years on end and expect them to be able to rally back just at the snap of a finger. Renee?
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Renee, thank you, and Governor, thank you very much. My question for you, Governor, I'm sure you've talked with him or maybe expressed some kind of a interest in this topic, but the State Board Executive Director, Jonathan Daniels, had resigned yesterday, and knowing what what yourself and most of the other state government officials and the governors, the previous two governors, Haley Barbour and Phil Bryant, had worked with Jonathan on numerous projects, and they had been very successful on completing a number of projects, and yet there still is from the phase that I've looked at, there are still a few projects to go on. More or less, what is your thoughts of looking for a new person in this position, and where do we go from here now?
Well, Hunter, thank you for that question. We are going to work diligently with the board of the state port at Gulfport. We've got some fantastic board members. I know that they are committed to going out and finding the absolute best person possible to not only complete those projects that are ongoing, but also to look for new opportunities for our port. We've got a unique opportunity in our state. We've got the fantastic port at Gulfport. We have a great port that has many employees and individuals employed at private enterprise over in Jackson County. I appreciate the work that Jonathan has done for many years in our state, and we wish him nothing but the best in the future, nothing but more success, and we appreciate his efforts. Gerald.
You talked previously about legislation to protect business owners when workers or customers come to patronize the business. What about, will you support any legislation that protects the worker, whether that's providing new standards, another recommendation of the Mississippi Department of Health, that these businesses have to follow to keep their employees healthy?
Yeah, oh, absolutely. There's no question that we would support that. And in fact, if you look at I don't even know what the number is now, the number of executive orders that I have signed in the last 10 weeks that have the full force and effect of law, where we have set guidelines under which individual companies can reopen. Those guidelines are put in place to not only protect the companies, but also to protect the employees of those companies, and also to protect the visitors and the shoppers, if it's a retail outlet, or the individuals who are attending casinos, for instance. Those measures are put in place to protect all the people that are inside those facilities, and I'll continue to look for ways to ensure that we do that. Renee?
Anita Lee with Sun Herald has a question.
Great.
Anita?
Yes, thank you. Dr. Dobbs, I wanted to ask you about the serology test. Your communications officer confirmed that positive antibody tests are being included in positive test results, and I wanted to make sure that was the case. And also ask if the health department is tracking active infections separately, and are you rethinking whether these serology tests should be included, since they inflate testing numbers and give the public no way to discern the number of active cases? I know Georgia is taking theirs out of their totals.
Yeah, so we've always been aware of the pitfalls of serology, and we've talked about that several times, as you'll recall, about it being a concern, especially with the medical community. We've had a lot of conversations because it says it detects old infection, right? That's a different thing. I'm not sure what Georgia's numbers are, but it's such a small percentage of our testing numbers. It does indicate infection. It's just past infection, so it does give us historical perspective about the total number of cases. So there's value in it. We do have a sense of active infections, but basically it's going to be, if you take the recovered and then subtract the deaths, it's going to be everybody who's left. So that's a pretty easy calculation to make, and certainly something we could say. We can separate them out. That's not a big deal. I don't think it's an inflation of numbers. It's just a different mechanism of identifying an infection. And I can't remember the last part of your question. I hope I answered it all.
Anita, did he answer your entire question? Or did he miss one part of it?
I don't know, did he? I think he answered it.
Well, you're writing the story, so if you're happy, I'm happy. Yes, sir.
Governor, with the reopening of colleges and universities, will there be like a hiring of extra hands to help clean and disinfect dorms and cafeterias?
I would anticipate we have a very capable, competent board at the institutions of higher learning, and we have 8 very good presidents. I am confident that they will put plans in place to do extra deep cleaning on those facilities. I'll tell you, there seems to be 7 new studies out every day. I don't know how Dr. Dobbs and them do their jobs in looking at all these new studies that say these various things, but now there are more and more studies coming out that are suggesting that the virus maybe can live on surfaces for much shorter period of time than was originally estimated. I don't know what the answer to that is, and I don't know that it really matters. We're going to encourage them to do extra cleaning before students get back on campus, but I don't think that encouragement will be met with any resistance. Having very good, strong relationships with our university presidents for many years, I know them that they're going to want to do the right thing to protect their students. Joe?
Yeah, Dr. Dobbs, Florida and Georgia have seen a more than 10% decrease in cases. Other states like Nevada has seen more than 40% decrease, and this is on a 7-day rolling average. Are we seeing anything like that here in Mississippi? If not, why not?
So looking at our 5 or 7 day rolling average, we have seen some, and I hate to even say decrease because, it's so variable, but over the past several weeks it has moderated, right? So it has declined. The percentages are going to be a little bit less than the ones you've described. We will continue to have cases, and we knew we would. We knew we'd have sort of stable transmission. We continue to have transmission in the community, but we also have several factors that have been very important to our current cases. One of them is obviously outbreaks in long-term care settings and nursing homes, and so we're testing a lot of people. So we're going to find more cases. So we're going to have some increased numbers just because we're finding a lot of asymptomatic cases. We're actually finding a large number of asymptomatic cases that, based on symptoms, would never have been detected. So that's going to increase it somewhat. But we want to find those people, and that's fine. And then certainly we have these geographic areas of excess transmission that we're working on. And then, we hope to see continued moderation in the number of cases and decline. But as we open up and let people get back to normal, the individual measures that people can take in following the guidelines and following the rules are going to make a difference.
It's incredibly important that we continue to stay vigilant in this fight. It is incredibly important that the people of Mississippi do the little things, if you will, because the little things will make a huge difference long term to ensure that we're seeing they're not going to get ourselves in a position where our healthcare system is strained.
Dave with WLOX has another question. Great. Dave?
Yeah, Governor, I want to go back to workforce development, where the object is to train Mississippians for high-tech, higher-paying jobs. The problem is we don't have a lot of high-tech companies in Mississippi. So are we just training people to move and work in California, Colorado, or Texas? Or do you plan to recruit companies to Mississippi? Or does your plan include more traditional trades as well?
Well, what I would say to you, Dave, is that we are going to continue to recruit business and industry into our state, but Patrick will give you the specifics, I'm sure. But when you look at the number of jobs available right now in our state, in manufacturing, in energy, in healthcare, in IT, in communications, in logistics, and in construction, the number of people that we have prepared to fill certain jobs is much lower than the number of jobs that are available in those specific fields. And so if we will train our workforce in such a way such that we are producing potential employees for the jobs where we know the demand is already there because we've done the actual data work to prove that the demand is there, we can make a huge difference very quickly. Patrick.
Thanks, Dave. I think you make a good point. Awareness is a big issue in this, and that's one problem we want to try to we want to try to help solve. How can we make people more aware of what the high-demand occupations are? So our criteria are identifying occupations that are in high demand, but also provide the ability or the opportunity to pay people higher wages. And so, I would push back a little bit on Mississippi not having high-tech jobs, because the fact is most everything these days is IT-based. And so, just to use, one example of a position that was in particular high demand, and I think remains so, and especially will pick up once the economy starts coming back, are diesel technicians. A generation ago, diesel technicians did their work with wrenches and manual tools. Today, diesel technicians in the construction industry, in the logging industry, these guys keep the equipment that keeps the economy running, and they keep it running through IT-based mechanisms. And that's just one example. Some of the things on our list, the governor mentioned the manufacturing sector. We identified what we thought were the highest demand occupations before the event. At the top of the list, 3D printing, robotics programming, automation and controls, industrial maintenance technicians, precision manufacturing, getting down into the information technology, coding, cybersecurity, network specialist. So you get the idea. Most everything today is high-tech and IT-based, and so that's where the economy has taken us, is more of these highly specialized, skill-based occupations that are in high demand, and because they're in high demand, they pay people, they provide really good pay opportunities for people who choose to get the skills. But to your point, I think the issue is there is a real lack of awareness for what these are, and we hope to cure that.
Governor,
in the last few days, the Secretary of State put out the contingency plan for the November elections. I know you were talking about PPE. We've had a lot of questions from people saying, well, why are we just looking to expanding the absentee options for in-person and not vote by mail? They said if there's an existing framework, what would be the concern of adding that safety option of someone sending it in by mail?
Well, I think the answer to the question, and the question was regarding recently the Secretary of State laid out potential contingency plans for the November elections. What I would tell you is I believe that for the late June elections, we are going to be able to conduct an election in our state, and that people that choose to go vote will be able to go vote. We're going to provide PPE for those poll workers, and for an individual that goes to vote, I would recommend that they wear a mask, but I feel very confident that the vast majority of Mississippians are going to go vote, just as they do every other election, because they are proud and they know that the sacrifices that have been made for us to live in a free society. I think Election Day is important. I do not believe that going to a full mail-in process is the right thing for us to do in our state, and that's true whether it's a pandemic or there's not a pandemic. I believe we can vote in a safe, responsible way. We can produce results on election night as we have done in the past. I think we can do it in June, and I'm fully confident we can do it in November.
Tate Reeves with the Vicksburg Post has a question. Tim?
Thanks so much. Dr. Dobbs, this is a question for you. The casinos were allowed to reopen today, and many have. As y'all have opened up each sector of the economy, how long before you see or the data shows how that opening affected the numbers in any way, shape, or form?
So that's a good question. It'll take weeks to know if any specific action or even set of actions is going to impact our number of cases. It takes about 7 days for people to get symptoms, another 7 days probably to seek medical care. So if there is going to be an increase in cases, it'll take a couple of weeks for that to sort of filter through. We're hopeful that we won't see an increase in cases if people do those things that they know how to do, that living in the community can be done safely. A lot of us at MEMA and the Department of Health, we've worked straight through this, and we've had hundreds of people in buildings, but we have been very fastidious in every element of our safety, with temperature checks, with people staying home when they're ill, with a supportive environment so people can stay home when they're ill, when we're maximizing, work from home and that sort of thing. So there are safe ways to do it, and so we all understand that we have to get back to some sort of normal activity. It just needs to be a new normal so that we can do the things we need to do. And when people go to the casinos or other things, I just really beg of everyone to follow those safety measures. The things are simple. Wearing a mask is very simple. Not hugging someone, which I know you want to hug somebody, but unless they live in your household and you don't see them all the time, just wave. So if we can collectively be careful, it'll be okay, for now.
Seeing no further questions at this time, I want to thank everyone for being here today. We have had a period of time in our state where over the last 5 days we have not had more than 300 cases in any one day. That's after having several days, the 7 days prior, in which there were over 400 new cases reported. But again, daily testing and daily reporting is not as accurate as the giving the Department of Health the ability to, through their contact tracers, to go actually look at when onset of illness occurs. That's the chart that we focus a lot of our time on. But we have reason to believe that if we as Mississippians continue to be diligent, continue to be smart, continue to do the little things, it can make a huge difference so that we can get back to a more normal daily routine, and that's something that we are all committed to. So again, thank you all for being with us today, and God bless.